amidst Biden allowing the last of the COVID relief money to turn into a state slush fund, we now find out this that the PPE that many states stocked up on is now being trashed because it's expired, which, at least to me, is incredibly frustrating because this is gloves, gowns, gloves that could have been provided to people. You could have set up a program at libraries where you literally just gave these out to people, but instead they're being thrown in the trash. Where for just Ohio alone, they're throwing out $29 million in federal money that was going to 7.2 million. I think this is quantity number 7.2 million masks, gloves, and other materials. Where at least 15 states that contacted the Associated Press back, from Alaska to Vermont, have tossed a bunch of their PPE, where Rhode Island got rid of 829 tons of PPE, and Maryland has disposed of over $93 million in supplies. And Dr. Jorge Benjamin, the executive director of the American Public Health Association, says it shows that we really have to do a better job of managing our stockpiles. Because again, these are supplies that have gone to waste. It's literally wasted taxpayer money, it's wasted material goods, and these are things that could have been put into Americans' hands. Where Louis Eubank, who runs the South Carolina Health Department, says that anytime you're involved in a situation where you're recalling how difficult it was to get something in the first place, and then having to watch that go or not be used in a way it was intended to be used, certainly there's some frustration in that, and that's definitely an understatement. And other states still are making questionable decisions, such as Missouri, which is maintaining a 90-day supply, keeping even expired materials on the presumption that the federal government will okay their use in an emergency, which means that if things get really bad shortly for COVID, Missouri will be providing expired and degraded materials to their healthcare workers and to other people from the stockpile. So again, we're back into a bad situation. The tool that we had of states having the stockpile was never utilized appropriately, and now people are trying to save money, cut costs, hold on to expired materials, and when things get really bad again, they could be providing these expired materials that have a degraded level of protection to the people that need it most.